Experts in the Triad are applauding the new guidance from the CDC, calling it a practical approach to dealing with COVID-19. WFMY News 2's Avery Powell spoke with the chief of infectious diseases at Atrium Health, Wake Forest Baptist. Avery, does he think this new guidance is a good idea?
Stacy, Dr. John Sanders says even as the Omicron variant spreads around the country, now is the right time to shorten isolation times. The CDC says that most COVID-19 spread happens earlier on, usually 1 to 2 days before symptoms and 2 to 3 days after. Dr. Sanders says if someone is vaccinated, the amount of virus in their system drops faster and significantly by day 3 or 4, making them less contagious. Even with the Omicron variant, Sanders says this follows science and also allows crucial industries to keep running.
More and more people are getting infected and more people are going to have to be out of work. And we cannot have our healthcare systems overrun. We cannot have our critical businesses overrun because they just cannot get people back to work.
There has been some pushback on the new guidance, especially after Delta Airlines CEO asked the CDC to shorten the guidelines due to it impacting their workforce. But Sanders says the discussion goes beyond the airline.
Now, did the CDC change at the same time that a number of CEOs were talking about we need to make a change? Yes, because the data were piling up for everybody to see.
Sanders says we've seen the negative impacts of shutting things down, and this revised guidance balances out those effects with the science of the virus.